Hi guys, it's Cindy and Angela again with Back to 30, and today we're here with Dr. Paul Pietro. He is at our McBee Station Clinic downtown Greenville, South Carolina. Dr. Paul is a board certified gynecologist. He has done aesthetic work. He does it here as well as in Miami in the past. And Dr. Paul is doing vaginal rejuvenation, and a lot of women are confused as to what that means. Paul, would you mind helping us with that?
Sure. Good early afternoon. FemTouch, using a very widely known and very safe technology, fractionated CO2 laser, been around since the 80s. We've taken the technology, knowing how it works, where it's been traditionally used for on the face, neck, and décolleté, where it's able and has been shown multiple studies and through the years very safely and successfully to essentially restore and rejuvenate the skin tissue, rebuild collagen and all the natural normal cells and tissues that give these organs the ability to function normally. It's been modified that it now can be used and is quite helpful to restore the vaginal tissue back to its normal, healthy, functioning state.
So like when it was 30?
Back to 30, back to 40. The scope of the problem and why this is very, very helpful is that up to 80% of women going into or after the menopause will have some degree of vaginal atrophy. At least half of them, if not a little bit more. It's severe enough that it affects their quality of life. Burning, dryness, itching, very difficult or painful sex. Some will have changes in the bladder urethra functioning, where it can actually, those changes, the thinning and the atrophy of the tissue can actually lead towards mild levels of incontinence, as well as from mild levels of prolapse and things like that. The laser will allow us to restore those tissues very quickly. It's fast, safe, efficient.
About how long is an office visit, Dr. Paul?
The initial consultation would take obviously a little longer, so we can go through the entire history and understand the full scope of the problem, the effect on the quality of life. The actual treatment is about 3 minutes.
And then how often do you have to repeat the treatment?
Right now it's recommended a series of 3 treatments, typically 2 to 4, but 3 seems to be the magic number. That would be done an initial one, 4 weeks later a second one, 6 weeks after that a third one. Moving forward, essentially once a year as sort of a maintenance would be recommended to continue ongoing maintaining the vaginal health.
And really downtime, there's not really any downtime with this, is there?
The zero downtime.
And you don't have to be put to sleep to have the procedure. You do it right away.
It's the, if any of you ladies have had a vaginal pelvic ultrasound before, it's essentially just like the vaginal ultrasound wand as far as size and scope. And the treatment, as I said, takes about 3 minutes, and the vast majority report basically a mild vibration sensation, and occasionally, and it's more dependent on the thickness of your tissue at the time, a mild heat sensation, which typically is gone within an hour or 2 after the procedure. We give you some hydrating gels to use to help comfort that. The only downtime would be refraining from intercourse for anywhere from 3 days to a week.
Okay, that sounds really awesome and exciting, Dr. Paul. So again, back to 30, we are no surgery, no downtime in 90 days.
Big problem.
Thanks, Dr. Paul.
You're welcome.
Back to 30, join the fight. Cut out the signs of aging without using a knife. If what used to be north is going south at high speed, declare a war on father time and gravity. Non-invasive solutions without any fears. Give us 5 minutes, we'll give you back 10 years.